I really appreciate the interest that KOLR has in this. I've had the opportunity to go around and speak to boards of aldermen and community groups and school boards on this issue because it's very important and it is extremely controversial. But I've gathered a great deal of information over the last several weeks, and there are many more scientific studies out now than there were back in February and March when this really first came up. And I think it is pretty clear that the science clearly demonstrates that masks are effective. I talk about what I call the preponderance of evidence. Yes, you can find a study here or there that questions effectiveness, but if you look at the vast body of scientific literature, it overwhelmingly favors masks. It favors them in what I would call 4 categories. There are actual laboratory studies in the laboratory regarding the effectiveness of blocking transmission of viral particles and droplets. They've looked at all kinds of different fabrics and thicknesses. Duke came out with a really nice study, actually shows pictures of the masks they use and how many particles got through. All of those studies show that masks do reduce the droplet transmission from a person to the outside atmosphere. No question about that. The second thing we have are what I would call observational studies. That's where in communities where there was masking, we can see a distinct reduction in the transmission rate in that population. And that has been looked at over and over again. We have studies going back 10 years, mostly in the Asian countries where SARS epidemic really came from several years ago, 10 years ago. They did many studies there. We have studies in the United States, and nearly all of them show a reduction in populations where masking is used in a significant rate. The third thing we have are case studies, and we have one of the most cited case studies from right here in Springfield, the Great Clips experience, where 2 of their stylists had COVID, and they had 139 clients come through. None of them got COVID because the stylists were masked entirely and the clients were masked entirely. That is one study. It is an anecdote, if you will, but it is a pretty persuasive one. And then the last thing, which is relatively newer and does appear to carry through with COVID, and that is there is some relationship to the severity of the illness based on how much virus you inhale. And what we have found is if you inhale a larger viral load, you are statistically more likely to have a severe case of the illness. If you inhale a smaller viral load, you're more likely to have a mild case of the illness. So in the beginning, we talked about masking being most effective to prevent transmission. Now we know it also helps the wearer as well. And I think there are many reasons, and we will hear some today, I'm sure, for concern about masking, but I think the scientific evidence is nearly incontrovertible.
I'm going to side with the CDC. I'm going to side with WHO and the other doctors. I'm retired medical, and I know for a fact that masks work. If I were to hold a lighter, a lit flame to my mouth right now, I was going to do it as a science experiment live on camera, but forget that. If I'm holding the flame right here and I'm talking, just talking without a mask, I'll blow that flame out. I've held that same flame up to my mouth, coughing, full bore, hack, and it blows the flame out. We know for a fact that this virus transmits through the air in water droplets. It can stop the spread, but in order for this to work, we have to get on the same page. I mean, we can't have 50% of the population not masking up and the other 50% saying, please do. Because it's like going to a party and saying, okay, you don't drink alcohol, and then I spike the punch. Congratulations, everybody's drinking that spiked punch. And it's just, mask up. It's not that hard.
Well, the Freedom Fighter group is a group of people who united on Facebook because we oppose masking mandates. The problem with the one-size-fits-all approach, and that is what a masking mandate is that you are treating everyone as though they are the same, and every person is different. Someone who has never met me or you or anyone else, these people are not in a position to determine what is best for my health care. So, for example, I have asthma, and most of the time it's not problematic for me to wear a mask. If I am in a situation where it's very hot outside or where I need to go up a couple of flights of stairs, it's nice to take the mask off. That's something that is, only I can determine that. The problem with the masking mandate is that it has created an atmosphere of fear and hostility in our city. You can't pull your mask down when you're short of breath. Someone will say something to you. I've been walking by myself with a mask in my hand, no one anywhere close to me, and cars driving by will yell things out the window, vulgar things, that you need to put your mask on. So I feel like we go a little bit overboard, and we do that at the cost of the individual's health.
As the doctor was saying, you know, I'm an attorney and I deal with facts, and I also deal with things that I can see that are tangible. We have been dealing with this mask mandate since July. Other cities, much larger than Springfield, have been dealing with it even longer than that. And so what is the evidence? All right, you cannot walk into a Walmart store without a mask, right, or Hy-Vee, or any other really place to do business. Can you walk into a restaurant? To be seated, you have to have a mask. You're safe once you eat, you're no longer contagious, but then if you go up to the bathroom, you're contagious again, you got to put on a mask. The point of it is that numbers every day, we're hearing from you guys, from the radio, a record-breaking day, another record-breaking day of COVID cases. So explain to me, doctor, we've had mask mandates. You can't buy toilet paper anymore. You can't go buy food without putting on a mask. You can't go out to eat with your family without putting on a mask. You can't go Christmas shopping for Black Friday without putting on your mask. How is it then that our numbers just keep skyrocketing? But then we look at other states, like South Dakota do not have a mask mandate, where their numbers are almost right in line with other states that force this on its citizens.
So there's multiple factors that go into the transmission rate and the infection rate in any given state or community as far as that goes. There are pretty good projections that suggest this is the trend where we are now with the amount of masking in any given community, whether it's 30% or 70%. And what would that be if everyone masked or the masking was greater by 15%? And what would it be if the masking was relaxed? Or if other measures were relaxed, like social distancing or size of gatherings? And all of the projections show differing curves in each of those situations. So it's a multifactorial transmission rate, and a masking is a piece of it. It is an important piece. If you look at any advice, medical advice, there are 4 things you do. You mask, you social distance, you wash your hands, and you quarantine or isolate when that's relevant.
But not to cut you off, but you keep talking about projections and whatnot, but isn't it true earlier in this year we had projections that too many people were going to die, 2 million people were going to die. Our projections are models that if we do nothing, these are the things that are going to happen. These models, can we really trust?
Yes, we can. The difference, this is an example I give, and part of the problem with trusting the evidence is the rapidity with which it has changed. We know more now than we did in January when it first hit. We knew more in March. We know more now. An example would be diabetes. We don't treat diabetes the same now as we treated it 10 years ago. 8 years ago, a new development came in. 6 years ago, another one came in. 4 years ago, another one came in. And when my patients come to me, they expect me to treat them in 2020 medicine and our understanding now, not in 2010 medicine. The difference between this and diabetes and COVID is that it has evolved so fast that it makes it sometimes easy for people to question, well, why is it different this month than last month? It's because we know more this month than we knew last month.
See, so the problem with that then is what I'm hearing is this will go on indefinitely if that side is in control. Why? We got a flu vaccine, right? But we have a flu vaccine for many, many years. People take it and they still die of it. So we're going to have a coronavirus vaccine that's going to be coming out maybe at the end of this month by Pfizer. Well, this virus keeps mutating or keeps changing, is what I heard the good doctors say. So much like the ineffectiveness of the flu shot, we're going to have a COVID shot that is going to be ineffective for a good portion of the people. So guess what? We're going to have to keep masking and probably, I guess, to be safe, because we don't want anyone to die forever, because there is no cure.
I don't want my comment to be mischaracterized about what has changed. I'm not suggesting the virus has changed. I'm suggesting that what we know scientifically, having had the opportunity now to watch it over the last 10 months worldwide, we know more about its behavior, we know more about its treatment. If there's a good thing, if there's any kind of silver lining to this, if you look at the Missouri statistics, we are continuing to increase in the number of cases per day. We have seen a dramatic decline in the number of deaths per day. We know better how to treat it. We know better how to protect people. And it has resulted in a significant decline in deaths.
But you say, you admit that the information that we have changes all the time. And when you spoke the first time, you brought up the CDC and the WHO, but their recommendations have flip-flopped numerous times. The CDC and the WHO have both alternated between recommending masking and saying that it's not necessary or not necessary in certain circumstances. So at what point do we realize, I mean, where do you draw the line?
So I will grant that your comments earlier about it isn't necessarily one size fits all are true. There can be exceptions, there should be exceptions. But the science behind it is pretty clear, and the more individuals we have masking more of the time, the better off we will be. How we accomplish that as a society is a different argument altogether. And I do believe that we will see a diminution of this next spring or summer sometime, again due to a variety of factors, our continued better understanding, our continued adherence. The vaccines may prove to be of some benefit. The two vaccines that are leading in the United States, the Pfizer vaccine and the Moderna vaccine, based on their research, are 90% or more effective. So that will make some impact. So we have different levers that we as a society can pull. How hard we pull them or how far we take them, I think, is the social discussion that we must continue to have.
And I think that's why we're here. You know, the question is, what is the role of the government, right? The Constitution matters a lot to me. I've taken an oath to uphold that one. And what is the role, what is the authority that the government has? You know, they keep calling this is an emergency. The mayor has re-upped that again, saying this is an emergency situation. But yet we have 99.9% people survive, or 98% of people survive. We're not talking about the death plague, or, you know, we're not talking about malaria. We're not talking about anything else. We're talking about a virus that has you have a better chance of surviving that than the vaccine coming out being effective. And so our problem is that the government comes up with these laws or these ordinances or these mandates, and they state that you must now wear a mask, but then they come up with exceptions. Unless you're at a swimming pool, you're safe. If you are eating your food or drinking your beverage, you're safe. Somehow you're safe. And now they want to mandate you wearing masks in your homes. It's coming. The Governor Cuomo has already stated that is what the next step. If you have people in power who enjoy power, they want what? More power, more control. And so, Doctor, do you suggest that it'd be a good idea this Thanksgiving that we all wear masks inside, that we should limit our families and pick which of the 10 we want in our home? Because trust me, there's several. I would mind using that as an excuse not to come. Sorry, doctor said I can only have 10 people here. Should we take it to that level? I mean, is this virus so deadly that we need to mandate people wear masks at home. If you're making love with your wife, put on your mask. You don't want to, contaminate people. Should we go that far?
So I'll respond, and I probably need to let some of the others speak a little as well. So it is true that in the state of Missouri, about 5 people per every 10,000 in the state have died of COVID. About 4%, 4 out of every 10, have already had COVID in this state, or excuse me, 4 out of every 100 have had COVID. But if you look nationwide, 1,600 people are currently dying per day. It will be over 2,000 before we peak. That's like 5 fully loaded jetliners falling out of the sky every day. If that were happening, don't you think we would take some pretty significant approaches? Do I personally think we should mask at home when no one has been exposed and you're with your own family or during intimate relationships? I don't personally believe that's the case. There are some that may be asking for that. I'm not sure that's where the science is. I kind of stick by the science, and the science says what I've just suggested already.
And the other problem that we have is, let you talk, but the other problem that we have is these same leaders who make these laws, make these ordinances, violate them time and time again. When we saw Mayor Lightfoot out there on November 7th, right? Not social distancing, right? Not wearing a mask. We see Governor Cuomo walking his dog out in public. People wearing masks around him. Governor Cuomo not wearing his mask. Or Nancy Pelosi going to a hairstylist when the place is supposed to be closed for our safety, getting her hair done.
I saw it locally. We have a city council meeting that's broadcast on Facebook, and we're all supposed to be social distancing and wearing masks. They're sitting elbow to elbow at a table with no masks on, and I type in on Facebook, "We can see you. You're not following the same rules that you're expecting us to follow." I mean, it's not just in other places. That's the attitude that we have here in Springfield. And, Doctor, I can appreciate that you want to help people be healthy and in some cases survive, and that's admirable. But ultimately, my health is my responsibility. It's my responsibility to listen to what you have to say and respond to it appropriately. We have all kinds of examples in our society. Smoking is very hazardous to someone's health, but people do it. It's not against the law. No one is going to limit severely we have some control over what we do with our bodies. We should have more than we have now, and we definitely don't need people who are in positions in government to try to stand in as our healthcare keepers.
You're right. I got to watch the governor of Missouri go to the 4th of July parade out in Marshfield. Watch him get within 5 feet of people, shaking everybody's hand, not masked up, not doing this. Part of the problem that we're having is that we can't get leadership to agree. When leadership can't come together on something and say, look, this is something we all need to do, that causes confusion down below. If there's no leadership above, you're not going to have that below. You say you've got a right. Yes, you do. I've got a right to drink. What I don't have a right to do is drink and drive because I put my community at risk.
Well, with our governor, I mean, his position was never that everyone, it's not like city council in Springfield where they were telling us that we all have to wear masks. He's had a different position. People who were not comfortable with being around him when he's unmasked don't have to be. I would approach the governor and shake his hand if he wasn't wearing a mask. If you're not comfortable doing that, then by all means, do what you're comfortable with.
It comes down to respect. I sit here and I listen to these arguments, all the time. We have these facts and figures. We have these facts and figures. This virus doesn't care about facts and figures. It doesn't care. It has one purpose and one purpose alone, to breed and multiply. And you're either helping it by helping it spread, or you're doing something to slow it down and mitigate it. So the choice that you have to make, you say it doesn't matter. Well, there are 245,000 people that disagree with your opinion. They're dead. They are dead. If a car manufacturer, you say, government can't tell us what to do, but if a car manufacturer has a car that's unsafe, it gets recalled, they fix the problem because too many people are dying. Look at Pinto with the exploding gas tanks. Sometimes government has to make decisions. in the best interest of the people. They make decisions to go to war because it's to keep us safe. They make decisions to say, yes, we've got to stop ISIS. We make decisions that put other people in harm's way. Our healthcare providers are out there every day fighting this thing on the front lines. And you have the audacity to make it some kind of theatrical performance in a courtroom. It's not. This is life and death.
See, there we go. This is feels.
This
Life
is
and
not
death.
Phil's.
99.8% of young people, right? But yet, City Republic announced today that they're going to shut down schools again. How much havoc is that going to play to parents who rely on having their kids in school? But oh my God, have I heard any numbers yet of how many school-age kids are dying?
Very low rate of transmission among children.
But we're going to shut it down.
Very.
Why? Because if we don't care, folks. We are scared. And that's what they do feels. That you are uncaring American if you believe that you don't want to wear a mask. You know, we quarantine sick people, not healthy people. But the left, they want to quarantine all of us. All of us. And it's going to be forever, guys. It's going to be forever because there is no cure. There's never going to be a cure. There's no cure for the flu. How come we weren't upset then? How come we weren't upset all those years, all those, because every life matters, right? How many people died? How many people did you see die of pneumonia? It's tragic, right? They're drowning, right? How come we don't treat that? We should all be masked up. We should all be in our homes. We should all be virtual. We shouldn't go to church. We shouldn't socialize with people because out of fear. But we don't, do we?
It's very concerning, the psychological aspect. When you talk about not going to church, I'm very active in my church, and that's a big part of my social interaction. So where are you when you have people languishing in nursing homes because they're isolated? Where are you when you have rates of addiction increasing exponentially, people who are developing all kinds of psychiatric and emotional issues because they're completely disconnected from others? I mean, we have to really balance the cost. And we can have interaction that's safe. We can't, I mean, I have yet to be diagnosed with COVID-19, and I have still continued to go to work, do my shopping, do the things that I need to do, and I take precautions that are reasonable when it's in the best interest of my personal health. If we don't have a masking mandate, anyone is still free to take any precaution that makes them comfortable. No one's going to fault them for doing that. It just gives us all the freedom to tailor the precautions that we're going to take to our individual needs.
If I choose to smoke and you inhale that, am I giving you a choice?
Well, if you're smoking around me and I'm not comfortable with that, I can move. I can ask you to go outside. I mean, there's a whole lot of gray area here, you know. And then the other thing is, if I inhale smoke, or even if I'm exposed to someone who is positive for COVID-19, I mean, inhaling the smoke doesn't mean that I'm going to die of lung cancer. Being in the presence of someone who's positive for the virus doesn't mean that I'm going to contract it. And even if I do contract it, there's a less than 1% chance that I'm going to die from it. So, you know, we can't really box ourselves into these if, then, or either or situations.
Well, you make a good point. And I've got about 20 years in recovery experience working with alcoholics and addicts. And I'm listening to the mental gymnastics you two are doing. I hope that you're willing to stake people's lives on what you're saying. I hope you're that willing, that you believe so much in what you're saying is true and right.
Well, science tells us that. 99.8% of people survive.
It's not my responsibility to control people's behavior. I mean, it's my responsibility to save myself, regulate my own health care. You're not responsible for doing that. So there's no reason why you should feel that burden.
You're right. We should do away with speed limits, stop lights, and everything else.
Well, that's not what I said at all.
Well, you're
not
saying
even
that it's not
close.
your responsibility. I mean...
No, that's not what I said.
No, you're saying that's what you said.
But it's this type of control that these are the same people who are going to tell you when the vaccine comes out, the government should mandate it. They should come into your homes and mandate. You should not be able to go to work unless you get vaccinated.
Have you guys heard what's, I'm not sure where it's at. You'll have to forgive me. I read a lot of stuff. But in one of these major cities right now, the nursing staff is preparing a strike. Because if, and I see where they're coming from in a lot of ways. If we can't get along and we can't agree on how to fight this thing together, or at least try to fight it together, then I can understand why they want to walk out. I'm retired healthcare.
I kind of don't understand why they want to walk out.
I'm glad I am not in the healthcare field right now, because I would be required to be there, to show up, to take care of people who didn't want to follow the advice of the CDC, who don't want to follow the advice of WHO, that don't want to listen to all these doctors and all these experts and everybody else.
I don't think that all healthcare workers share your outlook there. You know, I was a paramedic for several years. I didn't view it as a burden at all. People, you know, may drink and wreck a car, and my job is to be there and take care of those people. That's what I signed on for. That's why you're there. You know, when you're in school learning how to do your job, you know every day that there's some risk involved. But, you know, to the mind of most healthcare workers, the benefits of helping people outweigh the risks of the job. Every job carries risks.
In the mental gymnastics you talk about, well, follow the CDC, follow the WHO. Well, which recommendation? They keep changing. And who, you know, whose newest recommendation is that shutdowns are ineffective. Government shutdowns are ineffective. But what are our leaders doing? Fixing to shut down. Kansas City, shutting down. Chicago, shutting down. So are they following the recommendations of these scientists, these authorities? Are these the same people you want us to follow? It changes. It absolutely changes. And you're just scared, and I appreciate it. You're scared. There's a lot of people like you that are scared of something that is not going to, most likely going to kill you.
And it's not fair to mischaracterize our position as being like we're pro-death or we're being insensitive. It's actually quite the opposite. It is compassion that drives me to believe that people should be able to regulate their own health care. It is compassion that drives me to say we shouldn't be pushing people to the brink with mental health issues or substance abuse issues, or elderly people who are isolated in nursing homes. It is concern for their well-being that makes me take the position that I have.
I get that. I understand that. I understand that it's tough. These are difficult times.
You know, the big thing for us is make decisions, make mandates, make laws based on facts, reason, not feels. And the left has, that's their arguments, is feels, and they want to pull on your heartstrings of how many people have died and how many people, I mean, people die every day in car wrecks, but we don't stop driving, do we? And those deaths are tragic, aren't they? When people die in a car accident that had nothing to do with them, no fault of their own. Tragic, absolutely tragic and stunning. And imagine the family, right, that's been involved in losing a member of their family to a car accident that had nothing to do with them. But we don't stop that, do we? And statistically, a lot of people die every year in car accidents. A lot of people die statistically from drowning. We don't stop swimming. We don't stop floating. We don't stop going to the lake. This fear that is gripping this nation is trying to stop you from doing everything that makes us who we are. Going to church makes us who we are. Going to school makes us who we are. Congregating with each other. I don't know what these people are going to feel like when they say, all right, you can take your mask off. Are you? Are you ever going to take it off? I mean, at what point, I don't know, what point will you feel safe? There's never going to be a cure. There'll never be a cure. Like there's not a cure for the influenza, there's not a cure for the common cold. That kills people too. Pneumonia. So our point is that the government should not pass laws, or the mayor should not take actions on his own based out of fear. You know, let Americans make their own decisions, period.
I am concerned because it seems like every time that we give our liberties, give our rights away a little bit, we never get them back. It's a slippery slope. So if we're willing to give up our religious freedoms over a pandemic, so then what's going to happen with the next pandemic? When are we ever going to get those things back? And that is really my concern here. And also the fact that we are abandoning personal responsibility. Every individual should be able to determine what is best for their health.
And I agree with you on that point. I really do. Like I said, guys, it's a virus. It doesn't care about facts or figures. And you don't know how this virus is going to affect you as an individual until it does. And then you know. This country has seen hard times before. It saw it in World War II. We're going through a hard time now. We've been through depressions, we've been through wars and everything else. One thing's certain about life, people are going to die. That is true. But if I had that attitude as a healthcare provider, why bother going into healthcare? People are going to die anyway. You know, we shouldn't try to help them, shouldn't try to save them. Just, you know, it just doesn't matter. They're going to die anyway. We cannot afford to be cavalier about this virus. Because the thing about nature, the second you don't respect it, it'll get you. And humans are no match for Mother Nature. They're just not. That's all I got.
I think we're responding differently to this because of the magnitude of it. When we talk about how many people die of the flu, 30,000 is kind of a bad year. We're at 8 times that already. Pneumonia, 50,000 is kind of a bad year. We're at 5 times that already. Gun violence is 50 to 60,000 a year. We're 4 to 5 times that already. So it's a different magnitude, and I think it does require a different response. Maybe I come at this a little differently as a healthcare provider, as a physician, who have pretty much committed my career to putting the needs of others ahead of my own, to thinking more about the need of the patient than my own. And if you think about how that interfaces with laws, we make laws when people don't exercise good judgment in the first place. You can't drive 100 miles an hour, that's dangerous. There's more accidents at 100 than there is at, pick any number lower than that. So we make laws for that. If we exercised personal responsibility and cared as much about others as we care about ourselves, and I wanted to protect you as much as I wanted to protect myself, we would have more people wearing masks, and the impetus for any type of ordinance or regulation, I think, would be much less.
And we're also looking for new candidates to participate in our Common Ground segments. The next topics are potentially gun rights or abortion. If you're interested in participating, send me an email at this address. Francis Lynn, Ozarks First.